Hello, good morning, Sitaram, and welcome to the second part of this program in addiction and recovery. I'm your host, Ram Naresh Dwarika, and to just remind you, this program will be repeated again on radio and TV Jagriti at 10 p.m. tonight. It is also being recorded and will be posted on YouTube and Facebook at the end of the program. We have been speaking about the whole question of addiction to cigarettes and vape and marijuana and all of that, and the ill effects it can cause. This is so that just to continue, it is an established fact that 85% of lung cancer is as a result of cigarette smoking or smoking generally. Now, I want to say too that when people use a vape, they're not using a filter in it. When they use marijuana, generally there's no filter, so that all the chemicals and tar and all the soot and carbon and whatever impurities, they all go into the lung. And there is flora in the lung that can help to trap these things and have us expectorate them. But after a while, these metals, these compounds are so thick and heavy that eventually they go into the lung and they can't be expelled. They remain in there. And in the case of vape, it is now very well known that there's the whole condition of popcorn lungs. And there are other cancers that is caused by cigarette, not only in the lung, there's mouth and throat, esophagus, pancreas, bladder, kidney, liver, cervix, and acute myeloid leukemia. All of these are other cancers as well that could be related to cigarette smoking. We, of course, know of the popular chronic obstructive pulmonary disease. That is what is called COPD, chronic bronchitis and emphysema. That is the smoker's cough, they all the time. That is caused by smoking. And of course, this lead to a lot of breathing difficulties. I know a lot of eventually people end up on these little puffs that they use, with certain chemicals, and those in itself eventually in the long term cause problems for the lungs, because it cause you to end up with a lung that is very inflexible, stop and stretch, as we say, and then you really can't breathe properly. Now, if you are a person prone to asthma, smoking will only worsen the symptoms. It will also increase the risk of infection from diseases like tuberculosis and pneumonia. It makes you more prone to those. Now, as I alluded to before, but when we are smoking, we are putting so much more pressure on the heart, where the heart would have sent the blood one trip to the lung and pick up a certain percentage of oxygen. Now, because the lung is compromised and because of the smoke and cigarette and all of that, the blood has to send the blood several trips around the lung to pick up the same amount of oxygen. And so that you are going to end up with cardiovascular problems, damages to blood vessels. It also promotes plaque buildup and raises the risk of heart attack. So that a lot of people, they know that when you're smoking, it also causes the arteries and the veins to lose its flexibility. The flexibility in the blood vessels is what helps to regulate and keep the pressure, But when we smoke and these become hardened and inflexible, it definitely leads to either low blood pressure or very high blood pressure. Now, we also, not only the person who is smoking, but there's a tremendous amount of research that has been done on secondhand smoke exposure. So that although the adult, the father or the mother, the adults in the house might be smoking, in a lot of places, like especially in the Americas, Canada, North America, Europe, and so on, where You spend so much time. In fact, I know of houses that I have been to where the windows remain shut all year round. The windows never open. They're actually literally sealed so that in winter it can keep the coldness out. The windows are sealed and they don't open them. So that the air inside these buildings are very stagnant for the most part. And so that this, if you are smoking inside there, a smoker does not realize it. But after I used to smoke, but after I stopped smoking and I went to, in the old days, I went to cinema. I would come back and all my clothing and hair and everything would be smelling of smoke. Once you are in the same environment with people who are smoking, you don't realize it, but your clothes and your pores and your body and your hair and everything, and especially your lungs, since you're breathing in the air, it's just like you are smoking. So children are at higher risk of sudden infant death. It's called SIDS, and they are more susceptible to asthma and respiratory infections, even if they're just living in that environment. And to compound that, when we come out of the house in New York and we go into the streets as well, the amount of carbon monoxide from all of these vehicles running around, you know, I mean, our lungs come under tremendous pressure. And while we don't die, most of us don't die suddenly, but over time, the quality of life depreciates all the time. And then it is no wonder why, although in the Americas and so on, I'm not being critical here, but being realistic, while there's so much advances in medicine, and one might pause there. Why we have had to have so much advances? Because we have people becoming more and more sick. The demand for treatment and medical care is much more acute because people are now, the quality of life has depreciated. And in spite of all of these advances in medical care, people continue to be more and more sick. The medical bill in the United States, I think, is the highest in the world. Now, smoking also affects reproductive health. It reduces the fertility in all genders, men and women. And this is especially so when people use marijuana. And I know a lot of men are very particular about this, and I manage to get their attention when I bring this fact to their attention that look, the marijuana is going to reduce your sperm count, and it is not coincidental that a lot of men and women who smoke marijuana, and mostly men as well, they are unable to conceive and reproduce. Now, in pregnancy, there's also the risk of miscarriage. There's preterm birth. There's low birth weight, and there are birth defects. Now, we also know that happens from alcohol as well. The whole question of the small brain and the large head, micro and macroencephaly, they call it. But with cigarette, it can also have a very damaging effect on the fetus. Of course, the person's oral health suffers. Now that I have stopped smoking, I mean, I really go back and think, what it would be like when you're living with someone who's smoking cigarette. You have a husband or a wife who's smoking cigarette. And, people don't smoke one cigarette and then go brush their teeth after. You smoke, especially like I used to smoke a whole pack in a day. Can you imagine the state of your mouth, the breath? It's like kissing an ashtray when people have to be intimate, and a lot of men will, you know, especially the drinking and smoking, will accuse the wife of being unfaithful or maybe looking outside of the relationship because they refuse to, be intimate with them because of the smell. There's nothing that can turn someone off like a bad breath. And I'm saying that pointedly. I know it's not pleasant, but you who smoking, you don't smell yourself. You don't, although your nose is situated right above your mouth, you don't smell your mouth. Other people, and this is a very sensitive issue, so people don't tell you about it, you know, and as a result, you are not aware a lot of times. Now, smoking, vaping, marijuana, and when I say smoking, I mean all kind of smoking. Marijuana, whether it be cigarette, no matter what brand, whether it be chillum, whether it be vaping, they all accelerate aging. Your skin actually starts looking aged and wrinkled long before. It also causes premature wrinkles, sagging, and a dull complexion. The skin is the largest organ of the body. A lot of people don't know that. But the skin is very important for those people like me who are in complementary medicine. I could just look at your skin and have a pretty good idea what's going on inside of you. Your skin do not really hide you very much. It says it on your skin says a whole lot of things, whether you've been eating too much sugar, you have all of these little moles, flesh moles coming out in your skin, you have black spots coming out on your skin. If you're insulin resistant, your skin will show it. If you are not hydrated, your skin will show it. And so there's a whole lot of things that is evident on the skin. And so smoking also compromises your immune system. It weakens your defenses, prolonging healing and increasing infection susceptibility, because every cell, for it to be healthy, has to have oxygen. And when the cell themselves is being starved of oxygen, they are not able to protect you. In the case of vaping, for instance, in my recent experience, the blood test came back that the person's white blood cells were extremely high, abnormally high, while your red blood cells were extremely low. When your red blood cells are extremely low, it means it's like if you needed 10, 10 trucks to carry sufficient oxygen to all parts of your body, and now you only have 2 trucks. Some parts of your body is not going to get serviced with the material it's need, the food and the nutrition and the oxygen. And the red blood cells is what carries it to the rest of the body. All the anti-inflammatories, all the medicine to fight the diseases and so on is carried in the blood. The white blood cells, especially, the fact that there's an increase, it means that the body is fighting a war inside. And this was as a result of vaping. So that these are all very, very important indicators that tell you that you're killing yourself from inside. Now, in addition to that, of course, you become addicted. Cigarette, to my mind, I've been working in the field of drug addiction and alcoholism for over 40 years. And I can tell you, among all the addictive substances, cigarette is the most difficult to get out. It is more difficult to come off cigarettes than cocaine because it is legally available. It is almost fashionable. A lot of people don't really mind it. They think it's stylish, it's manly to be able to sport a cigarette and to smoke. I mean, I have to give kudos to the governments now that they have banned it in certain public places and so on. But I don't think that is still doing much of a dent in the amount of people smoking. And now with the vaping, you have a double whammy there. So the nicotine dependence, people, it is highly addictive. Nicotine is highly addictive as well. It is very a compulsive thing where, you know, That was one of the reasons I stopped smoking. I had stopped drinking, but I had still been smoking for a few days after, and I thought, what's the point in saving myself from alcohol only to kill myself with cigarettes? I mean, and because cigarettes smoking is much more compulsive. If I did not have one for the morning, I couldn't drop asleep in the night, just knowing I didn't have a cigarette for the morning. If I had coffee, I had to have one. If I had to go to the washroom, I had to have one. There are certain triggers associated with cigarette smoking. So that night, I had no cigarettes for the morning, and it was almost midnight, and I went up and down the road looking for a place for cigarettes, and I didn't get any. And I ended up way out in a place in Chase Village, this place of ill repute, but they were open. And and then I asked myself, what the hell am I doing here for cigarette? And that was the last. I said no. I had to stop. Thank God I did. It was one of the best decisions I've made in my life. And then, driven by addiction, you can find yourself in all kinds of places doing all kinds of crazy things. And then there are other risks that are peripheral, that are sidelined, adjunct to cigarette smoking, like diabetes. Because of the increase in insulin resistance, people are more tended to suffer with type 2 diabetes. Now, when you're smoking, the smoke is always in your eyes, so that it can lead to the cause of cataract in a lot of people, and age-related macular degeneration, it is called, where you lose the ability to focus properly, and it can lead to a loss and a decrease in your ability to see properly. So that it can lead to vision loss, and according to some research, it is also suggesting that you can suffer with a higher tendency for osteoporosis, and as a result, you can be at risk for fracturing. Your bones become more brittle. Now, there are many, many reasons that's related directly and indirectly to smoking. But as a person, I'm an acupuncturist, so I see people with stroke all the time. I thank God acupuncture seems to have a very good uh, prognosis when it comes to dealing with patients with stroke, because it can stimulate the nerve. But I'm also aware, working with the elderly people, and before I started doing this work, I was a social welfare advisor, and I'd visit old people who were applying for pension and so on. That was my job before. And I know the research has shown that once you have a fracture, especially old people who tend to fall because of high blood pressure and all of that, when they stand up, they get dizzy because of the lack of flexibility and the pressure in the brain arteries, as I spoke of earlier. They fall, and when you fall with a brittle bone, you can break the hip. And it is estimated once you get your hip broken, anytime after 60 and so on, old people, in no time you will degenerate and die, because you will not heal quickly. You will become bedridden, let alone the amount of problems you create for the rest of the people who have to take care of you. And if your children and adult now and gone, they're working or migrated, what's your position? You are going to stay on that bed there, and in a matter of days, you can die because of lack of attention. So that this is not a trivial matter, and old people tend to smoke because, yeah, they're sitting there and they think it is fashionable, and they've already become addicted. And so I've heard all kinds of excuses, and I used to make them too. So I understand, they say, well, look, if if I don't smoke, I will still die. If I smoke, I will still die. So I like to smoke. So let me smoke. But you will not die right away. You'll suffer. So that there's a lot of limitation. The quality of life is compromised when we're smoking, especially when we've been smoking for a long time. It causes physical limitations, reduced stamina, even in young people. I know people who play football with me in the old days, and those who were smoking marijuana and cigarette, they couldn't outrun me. At the time, I hadn't started heavily yet, but eventually I too could not run because when you're smoking, your lung become compromised. You lose your stamina, and as a result, not only to run and play football, but in your daily activities, you start becoming winded and all of that. Let alone a lot of people, when I talk to them about smoking, the first thing comes to their mind, well, if I stop, I will save money. Well, that is true because money, we measure a lot of things, success by money and all of that. And yes, you will because it is a very expensive habit. And if you sit down and calculate, I don't know the price of cigarettes right now. In my days, it was $2.50 a pack and $2 a pack. No, I heard some people saying some is $35 a pack and all of that. And the stigma associated with cigarette smoking. There's a lot of people who are really disgusted if they have to sit next to a person. Now, in a taxi, you can't smoke anymore. But if you have to sit next to a person at any function who's smoking cigarette, you will see people just getting up and walking away. From people who are downwind, they're going to be stooping and all of that. And it is not a pleasant experience because of the secondhand smoking. It is really a serious matter for others. It is very inconsiderate when you have to be smoking in company. So there are definitely a lot of benefits from if you quit smoking. While quitting, it reduces the risk significantly, and prevention is ideal. Resources like nicotine replacement therapy, counseling, and support groups can aid, but I don't recommend substitution, you know. And I just want to say before we close that while it is very difficult, as I said, it is one of the hardest things to stop. It is not impossible. If you know, I have helped thousands of people with this program, and in my practice here, I've helped a lot of people to stop smoking. In fact, right now, I'm working with several people who have been able to stop. Of course, I am not privileged to call their names, but one guy is about 40 years now since he stopped. And I'm saying to all our listeners, this is how you do it. You have the desire to stop, learn more about the consequences of smoking so it will boost your desire to stop, your motivation, and you pray to the God of your understanding to help you to stop smoking. You keep something sweet. When you feel to smoke, you take a sweet or chewing gum. And your first day when you stop, it will be the hardest. Just remind yourself that if you don't smoke, you will not die. And by the fourth day, it will not be very difficult. The physical withdrawal, most of it will have cleared up. Now, I use acupuncture to help people to deal with the physical symptoms. That is an option. But by the fourth or fifth day, once you are in counseling and support, you understand what you have to do. You stay away from the friends who are smoking. You get rid of the cigarettes that you have or the vape. Your lung, thank God, the lung is one of those organs that can regenerate. However, if with vaping, if you get to the stage where it is become, they call it popcorn lungs, that is almost impossible to reverse. Then you may be on a ventilator for the rest of your life, lying down on a bed, and it's not a pleasant experience. You lie there until you have to, and it can cause death prematurely. So this is a serious thing. If anyone has questions, of course, my number's on the screen. You can text me. I will be posting this soon after the program. You can call and get further information as to how you can get help to stop smoking. It would be the best decision you have ever made. So I want to thank all of you who have been listening. As I said, the program will be carried again tonight at 10 on Radio and TV Jagriti. And if you have questions, you can type it in on YouTube and I would be happy to respond to them. Or you can call me at 671-3040 or text me at 768-5925. So thank you again, and until next week, have a blessed week. And you can do it if you wish. If you wish to stop smoking, you can do it. Thank you very much.